Hello everyone. So today I really want to chat about what every woman with PCOS should know about their thyroid. PCOS and thyroid health can really go hand in hand. Some of the symptoms associated with hypothyroidism, this is when your thyroid levels of the hormones are lower than they should be, can actually look like PCOS symptoms. So, some of the symptoms associated with hypothyroidism are things like fatigue, weight gain, intolerance to cold temperatures, brittle nails, brain fog, memory loss, dry skin, constipation, even irregular cycles, hair loss, difficulty losing weight, depression, low libido, and actually an increased risk of miscarriages. So, it's so important to get assessed for your thyroid, especially if you have PCOS. And if you have hypothyroidism, it's also important to look for signs and symptoms of maybe PCOS. So, today, what I'm going to talk to you about is how the two of them are related. So, first things first, I want to teach you a little bit about the thyroid and how it actually works. So, in the brain, you actually make this hormone called thyroid stimulating hormone. It stimulates the thyroid that sits in your neck, right about here, to release TSH TSH is thyroid stimulating hormone, stimulates the thyroid to release T4 and T3. Majority of it actually creates T4 and then it gets converted into T3 in other cells in your body. And what's so interesting is that sometimes T4 can actually get converted into this inactive form of the thyroid hormone called reverse T3. Now, the active form of the thyroid hormone is T3. So, in our body, in all our cells, T4 gets converted into T3, and this is the active form of the thyroid hormone. We don't want this T4 that's created by the thyroid to be converted into reverse T3. That's the inactive form of the thyroid hormone. And so, one of the ways PCOS is connected to thyroid issues is that when we have insulin resistance, it can actually impede this conversion of T4 to the active form of T3, which is thyroid hormone. And what happens is this T4 actually gets converted into reverse T3 if we have higher levels of insulin. So it's really, really important to first of all, figure out if you have insulin resistance and also if your thyroid is affected by it. Because the more insulin you have, the more reverse T3 you can be creating, and that can actually impact your thyroid because you're not making that active form of the thyroid hormone, and that's where you can get all these symptoms of hypothyroidism. So first things first, it's really important to get your thyroid assessed using lab work, so getting a full thyroid panel. That would include TSH, thyroid stimulating hormone that comes from the brain, free T4, free T3, and then also checking for insulin, so doing an insulin glucose challenge test or fasting insulin and fasting glucose to see if you have insulin resistance. So I hope that was helpful, and if you have any questions, drop them in the comments. Take care.